So I typically kick the episodes off by having the guests tell us who they are and what it is they do.
I'm Sue Dyson. I'm an equine veterinarian and have been so since 1980. But I grew up with a passion for riding. I was a competitor. I was most interested in eventing, but also did some show jumping. And I had the good fortune to produce from novice to advanced level 3 horses, one of which went on to compete at 2 Olympic Games. One did an a World Championships, and one of the others won the Junior European Show Jumping Championships twice.
Oh
So
my
I've been
gosh.
very fortunate in having developed horses and learnt a lot from having had those horses, and also had some horses that were failures, which gave me a big perspective on the problems that riders face with their horses, which was a huge tipping point for my profession as an equine veterinarian. But it also produced various other opportunities to learn from other people. So, for example, when I was competing at the Pony Club Championships, I was approached by a lady called Sheila Wilcox, who was the first woman to ride at the European 3-day event championships. And she offered me a job, and I couldn't take it because I was going to university, but I did go and work for her during my summer vacations and rode all sorts of different horses for her. She was a very strict disciplinarian. She was tough to work for, but I learned a huge amount. But also a big bonus was whilst I was there, Jacques Le Goff, who was the American chef to keep at the time, and Bruce Davidson came over on a buying trip. They rode some horses in front of them, which they subsequently bought. These were off the track thoroughbreds. And then, once I graduated as a veterinarian, I was fortunate enough to come to New Bolton Center, the University of Pennsylvania, to work as an intern. And very soon after I arrived, Bruce Davidson brought in his current world champion, Mike Tango, and he recognized me and said, "Do you want to come and ride horses for me when you have time?" So I said yes. So that gave me the opportunity to continue riding whilst I was in the United States. And I was there for 2 years, which was fabulous in terms of the experience of riding new horses, watching Bruce work horses, and watching other people come to give clinics there. It was again a learning experience. And also, whilst I was in the United States, I was fortunate enough to meet Dan Marks, who was at the time the American show jumping team vet, who had a very close relationship with George Morris. And he used to take me along at spare weekends to go and watch horses train with George Morris and also do some veterinary work as well. So that continued my learning experience with the competition side of horses and exposed me to all sorts of good riders, good trainers, all of which I think you can pick up from.
Mm.
And meld it all together is in terms of the work that I've done as an equine veterinarian, specializing in orthopedics and poor performance, so lameness and poor performance.
That's incredible. And although I want to get into the nitty gritty of soundness and whatnot, in performance horses, you clearly were a very competent rider. Top riders don't typically just offer anyone a job. What made you choose veterinary medicine instead of something like becoming a professional rider?
I didn't come from an equine background, and my parents were really anti me following an equine career, particularly my father, who said you should have horses as your hobby and not as your job. And to be honest, I probably didn't have enough of the killer instinct to be a good professional rider. I was a bit of a perfectionist. I was always wanting the horse to have a good time. I would want to see the horse progress. My mother would say, "Why didn't you go faster cross country? You could have won." And I would say, "I was third. The horse had a really good time. I really think the horse has made progress as part of this learning experience in his career." And it was at the time when you had to carry a minimum weight in
Mhm.
3-day eventing and even in 1-day eventing down to intermediate level. I felt that was a big disadvantage for the horses because if the horse made a mistake, if you're a big rider, you can adjust your position in order to help the horse recover. When the horse is carrying a load of extra lead weight, it's much more difficult for them. So I felt that I was at a disadvantage there as
Mm.
well. So there was a combination of factors. But I hadn't had a lifelong ambition to be an equine
Mm.
veterinarian. It was only when I was at the latter stages of high school that I thought, what am I going to do? So then when I did go to vet school, it was with the sole purpose of being an equine
Mm,
veterinarian. I never had any thought about doing anything else.
awesome. Yeah, that's so many times coming on this podcast, I will be chatting with someone and they'll say something like that. And I go, what made you choose this choice? And obviously, you've made great impact with it, but life always could have looked so different depending on the paths that we follow. So, you have developed this Ridden Horse Pain Ethogram. And for people who aren't vets, what does that mean? And on top of that, what are some of the more common signs of pain that we would see in horses based on that?
The scientific term is Ridden Horse Pain Ethogram, but I like to use the term Ridden Horse Performance Checklist when I'm talking
Mm,
to riders and trainers, because I think that's more understandable. We had to use the term ethogram because that's a scientific term relating to a number of behaviors, each of which have strict definitions. So, for example, mouth open with separation of the teeth for 10 seconds or more. That's one of the behaviors. The Ridden Horse Performance Checklist is a list of 24 behaviors. The majority we have demonstrated are at least 10 times or more likely to be seen in a horse with underlying musculoskeletal pain than a non-lame horse. And it is the total score out of 24 that's important. We know from substantial evidence now that if a horse scores 8 or more of these 24 behaviors, then it is highly likely to have underlying musculoskeletal pain. It doesn't tell us where the pain is coming
mhm,
from. It enables us to identify the likely presence of pain. There are some lame horses which will score less than 8, but I've never seen a horse which has scored 8 or more, which hasn't been a horse with musculoskeletal pain. And I think it was developed because I was very aware that many riders and trainers are poor at recognizing lameness, particularly hind limb lameness, and most especially if it's involving both hind limbs. So the horse doesn't actually limp, it just has failure of
mhm,
hind limb push, or it's performing less well. And people were not recognizing that. And therefore, when they were presented for investigation, they'd often developed secondary problems, either lameness in another limb, or they'd lost muscle over the top line and the neck because of the way in which they compromised their movement. So you were getting into a vicious circle of multiple problems. So the aim was to try to develop a system whereby riders and trainers, and also veterinarians, could identify the presence of pain earlier on so that with appropriate investigation and targeted treatment and management, we could get those horses back into work more successfully
mm,
and more quickly with better long-term results. And we could also use it to say, actually, this horse is only scoring 3 out of 24. It's likely to be a comfortable horse. Or you can use it in a situation when you're thinking about buying a horse, you've seen a video of it, and you see it's showing all sorts of abnormal behaviors. It's pinning its ears back for 5 seconds or more. It's swishing its tail repeatedly. It's struggling in the canter. It keeps breaking from canter to trot. And if it's showing 8 or more of the behaviors, there's no point in going to look at that. Well, horse
mhm,
has got a problem. So why buy a problem? So we can use it in all sorts of different ways. And you can use it in a situation when the rider is saying, I'm just not making progress. The horse is struggling to do shoulder in on the left rein. He seemed to be okay otherwise, but that's because they fail to recognize that actually the horse is uncomfortable.
mm.
And this isn't a training problem. It's a problem because the horse is uncomfortable. So it helps you to differentiate between a training problem and a problem that is pain induced.
That it's so interesting because as I was looking through the list, it's like, oh, I know a horse who's like checking all these boxes, and we haven't been able to quite figure out what's been going on with him, even with that help. And I was like, at least now I can definitely say, I think there's some pain going on, and we can stop training it to try to be better, and we can actually start working towards getting it better.
Absolutely. And I think we should add that I think it's really important that we encourage veterinarians to see horses ridden because
Mm,
the absence of lameness in straight lines or on the lunge does not preclude the presence of lameness when ridden. And if the veterinarian just sees the horse in hand and on the lunge and says, I can't see any lameness, the problem must be behavioral, that then he's missing a lot. You must evaluate horses ridden, and then we have to try to determine the sources of pain using nerve block techniques to desensitize the limb in various levels and find out where the sources of pain are coming from.
And why would a horse be different from like non-ridden evaluation to ridden evaluation?
There are lots of different reasons. The horse can move as it wants to when it's in hand and on the, whereas when it's ridden, it has to balance itself and balance with the rider. It's got the added weight of the rider, and it is usually being asked to do more demanding movements. Even if it's just repetitive serves, that's
Mhm.
more demanding than with a rider on, it's more demanding than on the lunge. And obviously, you've got the interaction of the tack as well. But it is very common to see lameness in probably in more than 40% of horses that look okay in hand will actually show lameness with.
Wow. So how does tack is always a thing of how does tack and maybe even riders in tack influence the way a horse goes and whether or not a horse I've had horses who had a mystery lameness, and one day I decided to ride them bareback and see what happens, and all of a sudden the head limp goes away. You go, "Oh my god, I the saddle fits fine, but it's clearly just the way they feel with the saddle moving." And so how do things like that interfere with the way a horse goes naturally?
Well, first, I think it's really important to recognize that a lot of saddles are not ideally fitted. In a recent study that we did looking prospectively at 150 horses that presented for poor performance evaluation, 37% had saddles that were not ideally fitted that were
Mm,
influencing performance. And of those 37%, majority had their saddle fitted professionally or checked professionally within the last 2 to 3 months. So a professionally checked saddle fit does not equate with a correctly fitted
mm,
saddle. And all of these horses, when the saddle was changed to a better fitting saddle, improved in their performance. It didn't make them normal because they also
mhm,
had underlying other problems, but the saddle is hugely influential, not just for the horse, but also for the rider, because conventionally, as riders, we need to sit in balance with the horse. So our weight distribution needs to be centered over the horse's center of gravity. So that's about the level of the 13th thoracic vertebra. And if our weight distribution is too far back, then that is going to compromise the movement capabilities of the horse and create some degree of discomfort too. And will make it also more difficult for the rider to be in balance, which is going to have a negative effect on the horse. And so I think that saddle fit for both the horse and the rider are hugely important. And I think one tends to underestimate also the importance of bridle fit. You see so many bridles with really long cheek pieces so that the buckles are really close to the temporomandibular joints, and that can affect performance. Horses which have got head pieces that are too tight, or brow bands that are too tight, or nose bands that are too tight, all have the potential to negatively impact on performance, particularly things like step length. So good tack fit is hugely important.
mm. So how do we know that our saddle fitting professional is actually, like, competent at their job?
That's a very good question. Because in the United States, you don't have any form of professional training and examination.
Mm,
Whereas in the UK, we have the Society of Master Saddlers, who run a training course and do an examination system, and then you become qualified under their auspices. That doesn't mean that they're all good saddle fitters, but at least they've gone through fairly lengthy, extensive training and apprenticeship.
mm.
Whereas in the USA, it's rather different. Whereas there are some very short courses, many people just set themselves up as a saddle fitter without much professional background in terms of training. So I think there's some very basic principles. Does the saddle fitter evaluate you ride the horse?
Mm.
Because if they don't, then they're not doing a good enough job, because the saddle has got to fit both the horse and you, and that
Mhm.
can only be assessed by them evaluating you ride the horse. And that's not just sitting on the horse, it's actually doing active things with the horse. And there's very simple things like watching the saddle. Do you appreciate abnormal movement of the saddle? The saddle at the back shouldn't bounce up and down. It shouldn't be oscillating from side to side. If it's doing either of those things, or if it's slipping consistently to one side, something's not right.
Mm.
Can I get at least 2 fingers underneath the pommel of the saddle whilst I'm standing in the stirrups? If I
Mm.
can't, then that indicates that the pommel is too low, and there is the potential for the pommel to be impacting on the spinous processes. Does the saddle fitter evaluate the width of the gullet relative to the width of your horse's back? So, is there enough space for the spinous processes and the associated musculature? Because if they're not evaluating the width of the gullet, they're not properly assessing the saddle. There are lots and lots of things, and I realize it's a minefield, and it's much more easy for me to say to somebody, your saddle is a problem. And I can demonstrate that by putting on a better fitting saddle and saying,
Mhm.
see the way the horse moves now, it's obviously much better. It's more difficult to get the saddle fitter to provide you with a saddle, because often saddle fitters and sellers only have a limited range of stock, and they are going to be inclined not to say, I haven't got anything suitable for your horse. They're going to say, this is the best I've got. But the best that they have is not necessarily what is ideal for your horse.
Yeah, saddles that didn't work for one horse work great for another. Brands work great for another horse. And so I think it really does depend on how well of a fit in general. It doesn't matter what kind of tree you have. If both of them don't fit, it doesn't really matter.
No, absolutely. I would say that the close contact saddles are probably the most difficult to fit, particularly because horses change in their shape throughout the year, depending upon their work, whether or not they're getting turned out, how much grass they're
Mhm.
eating, if they have to have time off for some other problem. The close contact saddles are nice for a rider to sit in, nice to feel that closeness to the horse's back. They are challenging to fit correctly.
I know specifically for me, I event. And so I have the forward flap cross country saddle. And I've had horses really struggle with the forward flap really be problematic for them because of the way their shoulder is shaped or whatever. And so that's definitely been a new thing I've had to deal with the amount of horses I see now versus when I was just a rider for my own 2 thoroughbreds. They're pretty basic. What are some things, maybe overall, that may limit a horse's athletic career?
I think lack of attention to detail in terms of the quality of trimming and shoeing from a very early age. And I'm talking about trimming from weeks of age. Lots of foals don't have their feet trimmed from soon enough. The sooner you start trimming their feet, the better limb conformation they're going to finish up with. Then I think there is the tendency to ride horses in confined areas on a repetitive basis without thinking about the effect of repetitive training in a fixed environment, doing the same movements over and over again, which are going to result in repetitive strain type injuries,
Mm.
and also what happens to the horse's mental well being as well. And I think for longevity, we have to have cross training. And in the event world, we're doing that anyway because the horses are doing both dressage, cross country, fitness work, and training for show jumping. So they're doing a variety of different work on a variety of different surfaces, which is fantastic. But for a dressage horse, for example, they by and large are going round and round in endless circles without any break. There's often a tendency to overtrain rather than thinking the horse needs time to stretch and relax. And if an exercise is not improving after 3 repetitions, you probably need to go away and do something else for a while, not keep endlessly repeating those bad movements. And I think that we haven't historically been quick enough to recognize low grade lameness. So horses have been kept going, and then they become labeled as sour or unwilling or grumpy. or stressy, because horses react differently to pain. Some become very hyper reactive, whereas others just switch off and say, I don't really want to go. That has not been recognized as reflecting underlying discomfort. One of the reasons is because we see this so much of the time, it has become completely normalized. If you learn to ride at a riding school, most of the riding school horses have got low-grade problems, and therefore they show behavioral signs of pain, like opening their mouths, having to kick them, swishing their tails. So those behaviors become normalized. We
Mm,
don't think that they are abnormal, whereas in fact they are abnormal. So we don't recognize those early problems,
mm,
but we should be recognizing them, because the sooner we recognize them, the more likely we are to be able to manage them appropriately. And then there's this culture of maintenance injections,
yes.
which to me are completely without foundation. If you've got a known problem, like the horse has got lower hock joint osteoarthritis, which is successfully improved by intra-articular medication, then it is reasonable to consider the fact that you will need to repeat that medication on a fairly regular basis to prevent that lameness recurring. But if the horse has had no history of hock-related problems, and it has not been proven that its declining performance is related to hock pain, there is very little value in treating the hocks, the stifles, and the fetlocks at the same time, because then you're overloading the horse with drugs. You
Mm,
don't know which injection has been successful. You are just effectively pouring money into the horse without knowing what's going on. So, in my opinion, I think that if there is a problem, we need to identify the source of the problem and therefore treat that in a targeted way
mm,
and perhaps change the management in some way. And if the horse is actually performing absolutely fine, there is no clinical indication, in my view, to be injecting joints,
mhm,
because that's not going to prevent disease. There's absolutely no evidence it will prevent disease.
mhm.
We should be using those treatments for when we have a problem. So I think that's really important. And one other factor I think that with respect to the development of problems is the fact that you have big show centers when horses are competing day after day and they're not getting adequate recovery time. So if they pick up a low grade injury, instead of them having several easy days through which they could probably recover from that minor,
Mhm,
they kept going and they kept
mm,
going. And my philosophy is that just because there's a competition there doesn't mean you should be going to that competition day after day. The horses need breaks. They need to do other stuff. And
mm,
that's really important to recognize. You wouldn't have a human athlete running the 100 meters on successive day after day, because they realize that the energy they put in and the stress that they put on their bodies for the 100 meters, if they're successful,
mm,
needs recovery time.
mm. What does recovery look like in horses? What are some things that we say we are? Because I know in the US, there will be like 2 week long shows for the hunter jumper stuff, right? And so you may go, and even if you don't compete every day, your horse might be stalled for like that whole time. So if you're in that environment, how often should you be like hand walking? How long should they stay in the stall? Does the stall help with recovery?
No, it doesn't. No human athlete would be sitting or standing in a room for 23 hours out of
Yeah.
24. They would be mobilizing themselves. And the same applies to the horse. So if you see our upper level athletes, it's currently the European Dressage Championships, our riders or their grooms will have the horses out of the stall, walking around, hand grazing, and doing that for a large proportion of. And that's really important because horses are inherently grazers. They need to be eating more or less all the time when they're not working, because that's going to be good for their gastric health. It's going to be good for production of saliva. The saliva is going to have a buffering effect on the acids in the stomach, which is going to reduce the risk of gastric ulcer syndrome. So both, and from a mental health point of view, for the horses to be out and socializing with other horses is also important. Being stuck in a small stall, and many of the stalls at horse shows are too small relative to the size of the horses, Not being able to see their conspecifics is a problem. Now, in the ideal world, we'd have all sorts of small turnout paddocks and show sites, but we won't have that, I don't. But we can adjust by spending a lot of time walking, hand grazing, walking. And there's nothing wrong with just hacking the horse around the show, so riding the horse, but not putting it under pressure. It's just walking, perhaps some long stretches in trot without drilling the horse.
And how long, say you do a mid-level jumping effort, 3 foot or 1 meter, we'll say. How long, I guess, until that horse is recovered from that? Where like they can, maybe they don't show the next day, but maybe they're good to show the day after or whatnot.
That depends on a number of factors in terms of their baseline fitness, their athletic ability, so how easy they find it to jump that 1 meter course. Because if they are jumping that at the limit of their athletic ability, that's far more challenging for them than a horse which is innately more talented and is finding it really easy to jump the 1 meter course. And it's also going to depend on the quality of the riding. So if the rider has hit all her strides, or he or she, and the horse has had a really easy time, that's great because the horse will probably not have sustained any untoward event after that. But if the rider missed a distance and the horse really had to stretch or got in really deep and had to really struggle to clear the fence, to get over the fence with or without clearing it, then that's more likely to have created some subclinical injury, which will take longer to recover from. So it does depend a little bit on the circumstances and also on the footing, the quality of the footing, because that will make a difference as well.
I know there's a lot of talk right now about these artificial rings and the footing. How does that influence? I've had the experience of my horse goes a certain way, and then I bring them to this venue and the footing is different, and then all of a sudden I'm riding a way different horse. So
That is why the principle of cross training is important, that you are working horses on a day-to-day basis on a variety of different surfaces so that they can develop the ability to work on different surfaces. But in saying that, there are some horses that hate loose footing. There are other horses that hate hard footing. So there are going to be individual variations which have to be taken into account. We know that footing is hugely important. For example, when the Olympic Games were in Athens, in Greece, there was a huge cluster of serious injuries amongst the upper level jumpers. They looked at the arena characteristics and the quality of the footing and the way in which the arena had been created, and they realized there were problems with that. Since then, there's been much more research done on what are the more ideal characteristics for footing. But I think, having spent some time in the USA, the East Coast and the West Coast and the bit in the middle seem to vary in terms of the quality of footing. And that has to be taken into account as well.
you've spoken a lot on how good riding is basically good medicine for the horses. How can correct training and good biomechanical training offset conformation flaws or physical challenges in horses?
I think that's a really good question. And I think it's a very important question, which is often overlooked, because we see a huge tendency at all levels for horses to be ridden with their heads behind the vertical, particularly when they're doing flat work or training for dressage. So they've got their head behind the vertical. Then, as a result of that, they cannot properly engage the muscles of the thoracic sling, and they cannot properly move through their backs. And the consequence, they cannot properly push from behind. So they finish up with this horse with a restricted gait, both in trot and in canter. The canter often loses a suspension phase just because the horse is not going forwards enough and is not being allowed to develop its musculature in the appropriate way. And I think that this is an important factor with respect to predisposition to the development of lameness problems. So for me, the way in which the horses are worked on a day-to-day basis is of huge importance. If you look at the prevalence of clinically significant impinging spinous processes or kissing spines,
Mm.
we will see time and time again that this is not a problem for the upper level riders because the way in which they're working the horses, back muscle development is such that they just don't have a problem. But the horse which is being ridden, such that it's got extension of the back, and the rider not truly in balance and not working the horse forwards enough, those horses finish up with chronic back pain.
Mm.
And these spinous processes being close together may be influential in that. So it's very important to me. And also having the horse balance. The training must be progressive. And this is something which perhaps is not fully acknowledged, particularly in the dressage world. When you take, for example, this exuberant young 3-year-old with incredibly flamboyant paces,
Mm.
and which has a natural ability to passage, for example,
Mm.
and therefore the horse is put under too much pressure to passage too early when it hasn't got the requisite musculoskeletal strength and coordination to properly support that.
Mm.
And therefore it's going to likely to be overexerted and therefore get injured early. And early injuries are going to predispose potentially to later injuries as well.
Mm.
So the quality of training right from the outset is very important. But you also have to bear in mind that you've got some professional riders who have the ability to get the maximum out of a horse
Mhm.
and make it look very good and cover up problems. And that's probably not good for the horse's longevity because they're not going slowly enough and progressively enough.
Mm.
There is this tendency to do too much too soon and take advantage of the horse's natural characteristics without realizing the importance of going slowly and developing the musculoskeletal strength and coordination that's needed for good competitive performance.
And so if you were, I know it's really hard to give generalizations in our world. One, I'm assuming when you say go slowly, you're not necessarily talking about speed and the speed at which the horse is going.
So I'm talking about making incremental changes in the athletic demands that we place on the horse. So if, for example, this horse has naturally got a very good extended trot,
Mhm.
extended trot results in hyperextension, that is oversinking of the fetlocks.
Mm.
That oversinking of the fetlocks is going to put incredible strain on the suspensory apparatus and predispose to repetitive overload of the suspensory apparatus
Mm.
and therefore injury. So if the horse naturally can do a good extended trot, we don't need to be training the horse in extended
Mm.
trot. We need to be moving away from that and doing the exercises that are going to build up its strength so that ultimately, when we want to do extended trot in a competition arena, we're going to be able to do it in balance and easily.
Mm.
So just because a horse offers you something that is good, it doesn't necessarily, or means probably you shouldn't be overly training that. You
Mm.
should be avoiding that to some extent. If a horse has got good technique, you don't need to be jumping it over lots of big fences.
Mm.
You need to be improving its gymnastic ability,
Mm.
so doing gymnastic exercises over small fences, but you don't need to be training over big fences day after day. Now, the rider may need to be training to get their eye in, but that's a different story. Then we
Mhm.
have balance between what's good for the rider and what's good for the horse.
And so when we're talking about, let's say, just about developing an event horse, because I think it does mesh. You can take something from the dressage and you can take something from the show jumping. I typically, for rule of thumb, when I'm developing a horse, I think a level a year, right? Because it gives them time to develop strength. The young horses, beginner, novice, or little levels. And so I think it gives them time to mature in the competition setting without necessarily putting strain on them. But are there, when do you think, if you had your perfect world of equine competition and whatnot, When are we starting horses? How long are they at each sort of stage? And how long does it take to, say, develop to, for the average rider, we'll say, our preliminary or your guys' novice?
I think that depends hugely on the horse, because
Mhm,
some horses seem to mature physically and mentally more quickly than others. So some horses may be ready to start groundwork as a 3-year-old, whereas
mhm,
others are not going to be ready till they're 4. And therefore, they're going to be probably a year behind as they go forwards. I think that a well produced horse now, and I'm talking about now rather than 40 years ago, because the novice courses, are, certainly in the UK, become much more technically
mhm.
demanding than they were 40 years ago. I would say a well produced horse should be able to do that as a 6-year-old
If
and
starting out.
3 or 4.
Okay, interesting.
There will
Sometimes
be some horses that will have to start later and they won't develop as quickly. So you have to go more slowly. And it does depend also a little bit on their athletic ability in terms of how easy they find it
mhm. Yeah,
and
it's
confident you are as a rider.
mhm.
So that's going to have a big influence as well.
I do a lot of work with off the track thoroughbreds. So typically when they've come to me, like they've already worked one career. And so I don't necessarily ever choose, okay, we're going to start this one as a 3-year old, or they come to me pretty much already going. But I've gotten more into developing young horses and whatnot. Yeah, you really see the range of at 3, this thing was ready to get to work, and this thing is 4.5, and it's in the middle of a growth spurt, and it's a bit immature, and we'll start groundwork, but I don't think anyone's going to sit on it for a little while. And it's so hard to make generalizations because they really are all so different.
Yeah, we have young event horse classes in the
Mm,
UK for 4 and 5-year-olds. They compete at the separate age groups. And the spectrum of horses that you see at the regional competitions among just the 4-year-olds or among the
mhm,
5-year-olds is enormous. At the championships, the spread is less enormous, but still there is a big spread. And you will have a few of them which have as 5-year-olds competed at novice level, but mostly they are with professional
mhm.
producers rather than amateur producers.
So if you could tell riders to do this one thing, maybe daily, to improve the comfort and career length of their horses, what would that thing be?
Going out in the countryside and hacking,
Mm,
because I think you can do an enormous amount of training whilst you're out in the countryside and the horse not being subjected to going round and round in circles.
mm.
And spoke to a podcast about from American show jumpers a few months ago, and they said, we wouldn't dare to go out hacking. And I said, you need to, both from a physical and mental point of view, from
Mhm,
the horse's perspective. And yeah, I think that's hugely important. And we cannot underestimate what we can do from a training perspective out on a trail ride. The horse is not going on perfect footing all the time. It's going on uneven ground. It's going on a slight slope. And that's all developing the horse's proprioceptive function, knowing where their limbs are. So the messages are going quite subconsciously
mm,
from the feet up to the horse's brain and then back from the brain to coordinate the movement of the limbs.
mm,
And to do that on a variety of different terrains, not just on a perfect surface, is of huge benefit to horses to develop this proprioceptive function and also to develop the strength in the ligaments supporting joints, for example. That is enormously important, I think.
mhm,
And we tend to almost mollycoddle horses. They need also to learn to think for themselves.
mhm,
They need to learn how to place their feet. So they need to be stepping over logs. They need to be stepping
mhm,
down several steps, learning to think for themselves. Because if we regiment their work too much, and there is a tendency to do that as cross country courses become more and more
mhm,
technical, then the horses lose that ability to have that third leg or fifth leg, I should say,
mhm,
and just think for themselves and get themselves out of trouble. Because most of us who have been amateur riders are going to make mistakes, and the horse has got to be able to help us get out of those mistakes. And if we've been too disciplined with them all the time and not allowed them to step over those logs going down a hill, go over those rough cobblestones, you may think that's not good for the horse,
mhm.
but actually, it is good for the horse.
Yeah, I remember a few years ago, I had this friend who had this really talented thoroughbred, and she had actually trained him up to, I think, pre St. George dressage, and he was an event horse. I remember he started having a lot of issues on cross country. And she always was saying, it's like he's waiting for me to pick the distance and do the thinking for him. So we basically don't make it. And I have a client who breeds hunter jumpers in the US, and I do a lot of work with for young horses. And actually, most of what I do is just taking them out on trail and teaching them lateral work and having them step over logs. And she goes and she wins everything. And I don't necessarily think it's because I'm sitting there hacking, but I think it's because they spend so much time not in the arena that the arena is actually still fun and they enjoy it, but they also get such a reprieve from needing to put 8 strides in this line. And that becomes so mundane to them, I think. And then you get boredom problems specifically with the young horses. Where do you see the biggest opportunity for improving equine welfare in sport over the next 5 or 10 years?
I think that's a very good question because there's a huge debate about the social license to operate. It's our public acceptance of what we do. And there's a huge dichotomy amongst the horse world, which is a big problem to me, in that you've got those people who would say all dressage is bad. We should never use a double bridle. We should never use spurs. We should never use the whip. Jumping horses over 1 meter 60 is not right. And then you have the people who say all horse effort, we should, and these are fairly vocal people from both ends of the spectrum.
Mhm,
I have the philosophy that I think that horses actually do enjoy working and progressing, assuming that they get time for socialization as
mhm,
well. But I think that we have to acknowledge that we have some problems in our sports and we have to hold up our hands and admit where those problems are and be seen to be doing something about it. And paradoxically, although it's the upper end of the competition world that gets all the criticism, it's actually at the bottom end of the
mhm,
competition world that we have more problems. So we applied the Ridden Horse Performance Checklist to horses competing at 5-star 3-day events and at World Cup Grand Prix dressage qualifiers
mhm,
and at lower level Grand Prix dressage, and also at the basic levels of eventing,
mm,
British eventing 90, 100, and novice. So jumping between fences between 80 centimeters and 1 meter 10. And at the top end of the sports, the Ridden Horse Pain performance scores were on average between 2 and 4,
mm,
with a very occasional horse that had a high score. And when we looked at the presence or absence of lameness, it was a very small percentage and often only seen under specialized circumstances like right shoulder in or right
mhm,
half pass or something like that. Whereas when we looked at the lower level event horses, we had a far bigger spectrum of performance checklist scores, with some horses scoring as high as 12 and showing overt lameness and
mm,
showing obvious signs of not wanting to go.
mm,
So this epitomizes to me that we have a much bigger problem at the lower levels. Therefore, we have to address this through education. And that means educating the trainers as well as the riders and also the owners. Because I think, particularly in the US, when you have so many riders that train in a barn underneath the auspices of a trainer, then the trainer wants to keep those horses and riders from a financial point of
mhm,
view. So it doesn't make it much commercial sense to him to recognize that there is a problem.
mhm,
But we need to acknowledge that there is a problem and be seen to do something about it. So we
mhm,
have to open the trainer's eyes to the fact that it's no good just keeping going with this horse. We have to say, this horse is clearly uncomfortable. We need to intervene and do something about
mhm,
this. And then I think that it's clear that within each of the disciplines, the stewards probably need to have more authority to act. And I discuss this because I'm on the US Eventing Safety Committee,
mm,
and we review video footage of horses. And clearly, there are horses being ridden to fatigue and they haven't been stopped.
mm,
So, this is a problem. But it also relates to rider education and teaching people when they need to say, enough is enough, I need to
mhm,
stop. And this comes to a head when there's a fatality of either a horse or a rider. Then we
Yeah.
have these reviews of what's happened. Everybody
Mhm.
says we must do something about this, and then often nothing does happen
Yeah.
about it.
I actually got injured over the winter, and I live in Aiken, South Carolina, so our winter season is our big season here. And so I spend a lot of time volunteering at events, and the amount of times I radioed in, "This horse looks tired," or "This rider is really having to, like, work hard for this." I was, like, towards the back half of the course, pretty much nothing happened in any of those accounts. But I realized I'm a trainer, I'm a professional, like, I can see the signs of fatigue. A lot of these people are parents or just people that really don't even know the sport or horses at all. They're not necessarily doing anything wrong, but they just don't really know what to look for. And the volunteer briefings before everyone gets sent out really don't talk about the things that you should look for. It talks about what do you do if a rider falls off, or what do you do if you have to hold a horse and rider. These are the things that you should be looking for in terms of like how the horse is going or how the rider is trying to influence the horse, which I thought was definitely something that could be improved upon in terms of just the volunteer system. But also going back to what you had said about the pain in the lower level horses. I had been thinking through this for a while because I think, especially in the United States, we're in such a weird system where the lower levels of eventing are basically paying for the top level riders. I pretty much never see professional riders striking their horses or getting too super emotional. If you have a bad ride, you might be emotional, but you're not getting emotional at the horse, or it does happen, but at a much lesser level than I see amateurs or young riders and the way they interact with their horses. And it it's so hard because so many professionals almost feel like they can't say anything. And because then what happens to, oh, these are my owners or these are my clients. And it really does create such a trap of how do we break through any of this to allow, because riders, if you're riding a horse that's in pain or a horse that just doesn't want to do the job for whatever reason, it's not fun.
No,
And
I'm often astonished how people will pursue riding a horse which really doesn't want to do it without asking the question why. There seems to be this lack of curiosity, which again goes back to the way we've been conditioned. We've been conditioned that if the horse stops, we hit it. Now,
Mm,
that doesn't make sense from a learning perspective. Why is the horse supposed to
mhm,
understand why it's being hit? It might feel fear now, and it may
mhm,
jump because it's frightened, and it might get a better experience because of that, assuming that the rider didn't get left behind. But if the rider got left behind, then the horse then has another negative experience because it got jagged in the mouth, or you got this bad situation being perpetuated. I think it's very difficult to know how to educate people better and to cross these communication barriers. It's what it is, they're communication
yeah.
barriers. But we need to lead people need to lead by example. It would need one good trainer to do something different and then for his group of clients to ultimately show they're getting better results. And that would be a way of turning this liner slightly to one side. So this big ship going in this direction, we may just be able to shift it a little bit in an opposite direction. But it has to be by example, I think, because that's what does make a difference, leading by example. So, for example, whatever you think about Charlotte Dujardin, when she rode with a helmet at the
Mhm,
2012 London
yeah.
Olympics, that transformed the use of helmets. And nobody now rides mostly without a
Without, yeah.
helmet. So that was one key person leading by example. And that just shows what a powerful person can achieve.
Yeah. This whole topic of equine welfare in sports specifically is just such a large topic, but I think just improving the way horses go improves so many of the other issues that we see overall.
Absolutely. People realized how much better a horse would perform if it was pain free and how much it would be more easy for you to ride that horse and how you would be so much more comfortable on that horse. If you've ridden a horse which had a problem before it's had nerve blocks and after it's had nerve blocks, and you felt the transformation in this horse's rideability and its willingness and the quality of movement through its body, you can't forget that experience. And I would love everybody to go through that experience so they would know what a normal horse should really feel like. Because I think that many riders have never actually had the good fortune to ride a pain-free horse. And therefore, they are just attuned to this being the normal when it's not normal. And even many professional riders are riding horses with low-grade problems, but can circumvent that to an extent by their quality of riding and their balance and their strength.
This has been an extremely informative conversation. How do people follow along with what you do, see your stuff, all of that sort of stuff?
I'm not active on social media. There is a website, 24horsebehaviors.org, where there's lots of educational material about the Ridden Horse Performance Checklist and all sorts of other commentaries about common problems. And I also liaise with Train with Trust, and we do monthly discussions about various topics, which are broadcast on YouTube and through Facebook Live.
Thank you so much for joining me. This was great.
You're very welcome. It's been a pleasure.